Hey guys, welcome back to Back in Motion in San Diego. My name's Dr. Sean Golden, and today we're going to be talking about what shin splints are, how you get them, and then the next video we're going to talk about things you could do at home to treat them and how we speed up that process in the office here. So first, to start off with, when we talk about shin splints, I'm going to use this foot model here. Now, when we talk about shin splints, it's going to be the calf region on the inside of the lower leg. So if we have this pointing towards you, it's going to be on the inside. It's never really on the outside of the lower leg. So if you have inside lower leg pain where you might be feeling it on the calf, or you might even be feeling it really close to the lower leg bone on the inside here, really close to the tibia, that could be shin splints that you're feeling. Now, there's two calf muscles. There's the gastroc and the soleus. The gastroc's not really involved, so we're going to pop this one off. And then when we take a look at soleus here, soleus is this big meaty muscle that is responsible for the majority of the weight of the calf. It's one of the strongest muscles in the lower body pound for pound. And when we talk about shin splints, it's the one that's involved. So the soleus, it turns into the Achilles tendon, but also it attaches onto the tibia on the lower leg bone here. Now, it doesn't attach directly onto the bone, it attaches to what's called the periosteum of the bone, which is the covering, the sheath that covers the bone. And the thing about the periosteum is it's very, very pain sensitive. So a lot of times when you have bone pain, it's really the periosteum that's causing that enormous amount of pain that you feel. So it doesn't like anything being tugged on it. It doesn't like any type of force being applied to the bone. So what ends up happening with shin splints is if we're sedentary, we're sitting for too long, we now know that that shortens the muscles. It doesn't make them looser, it makes them tighter. And then also, if you are a runner, if you do any type of jumping sports, if you've been running but now you're upping the volume or anything like that, where you're having a lot of demand on the lower body or the calf muscles, then that can shorten it even more and create this tugging and pulling feeling right onto the periosteum here. And when that starts happening over long term, you can actually get some little micro damage that occurs there, right where it's attaching to the bone. And when it gets to that stage, what that means is a rest for a week or two doesn't make it go away anymore. Now it's something that's become chronic and actually needs some treatment or intervention so it can adapt back to normal. Otherwise, you're just going to be dealing with this for months on end and it might not go anywhere, or it's going to take a really, really long time for you to see any change. So first and foremost, what we need to do is we need to get this muscle to relax. We need to stretch it out, get it lengthened, get it soft and pliable so it's not constantly pulling on the periosteum of this tibia here anymore. After that, what we want to do is we want to use things like Graston therapy, active release therapy, and cold laser therapy all along the inside of the calf muscle and really throughout the whole calf, so that the inner part here can actually repair itself back to normal structure. So we're going to start showing that treatment in the next video, and in the next video we're also going to talk about things you can do at home to treat this yourself. Alright, thanks guys. If you haven't subscribed yet, make sure you click the subscribe button below. And if you haven't seen our Graston video yet, when I talked about Graston therapy, that's going to be in the description below as well. So make sure you check that out because it really does a good job at explaining why that's so important of an intervention when you have a tendon or a muscle condition. Thanks guys. Have a good one.